when a client or a patient comes in for therapy, what does that look like? What's the first session?
So that's where people get really confused.
Okay.
They think EMDR, EMDR is an 8-phase, 3-pronged model.
Okay.
Where the 8 phases of EMDR, so they're different from start to finish, and then the 3 prongs are past, present, and future. It's all wrapped into what we call the AIP model, or the Adaptive Information Processing model that Francine Shapiro came up with. The idea with when you start EMDR, and this is what it's sort of a pet peeve, and it's just a lot of misinformation, is that EMDR, you just start. And while we just start because the first phase is history taking, it doesn't mean you jump into processing. So the first session is like any other session when you start counseling. You're going to do an intake. We got to get to know you. We're going to build therapeutic rapport because, it's hard to say, hi, my name is so-and-so, and here's my worst trauma. And if you do say that, we probably have some other dissociation or other things we need to treat because you're so disconnected. So the first thing we do is we have to widen what we call your window of tolerance. EMDR will push you to the edge because I'm having you go back, and what's the worst part of that memory is what we start with to kind of activate it. Well, not kind of, to activate it. So people get really confused and upset with us that we're not going to jump right into it, to the finger wagging or the tapping, because that's later on. And they don't understand or don't want to hear either one. I don't think as a client, I'd want to hear that. No, we've got to set you up well.
Right.
Because if I'm going to push you to the edge of your window and I'm going to bring up everything your system does not want to think of, you've got to have skills outside the session. You've got to have support. You've got to be able to tolerate your feelings and even name them.